everyone. I'm John Evans, and welcome to another episode of One-on-One. When the calendar changed over to 2020, most journalists in this part of the state believed that the potential sale of the county-owned hospital, New Hanover Regional Medical Center, would be the big story. That was before the coronavirus pandemic impacted our entire world. That was also before the tragic death of George Floyd sparked civil unrest and led to united calls against police brutality and against racial injustice. The sale of the county-owned hospital is a big story, and it is moving forward as we speak. The all-volunteer group put together to chart the future of the hospital made a recommendation to New Hanover County Commissioners that they move forward with an offer made by Novant Health. That offer included $2 billion in cash to New Hanover County and $3.1 billion to cover the hospital's capital project needs for the next 10 years. The deal has to be finalized by October 31st of 2020. In this week's episode, we hear from the leaders of both healthcare organizations, New Hanover Regional Medical Center and Novant Health, and we learn more about what this potential sale will mean for your healthcare. And first, let us introduce our guests today. First, the President and CEO of New Hanover Regional Medical Center, Mr. John Gizdic. John, good to see you again.
Good morning, John. Good to be here.
And the President and CEO of Novant Health, Carl Armato. Carl, it is nice to meet you, and we appreciate your time today. Thanks.
Thank you, John. It's great to be with you today.
Now, the negotiations are underway and moving forward toward finalizing the strategic partnership between the two healthcare organizations. John, I want to start with you. On the night the Partnership Advisory Group voted to recommend going with Novant, you said, "Tonight we choose possibility. Tonight we choose a healthier community. Tonight we choose to transform health in our region." Can you tell us how health is going to be transformed with this partnership agreement as it moves forward?
Certainly. And so that is a large reason we even began the partnership exploration, is how do we really move from just providing sick care as a health system locally here in southeastern North Carolina to really being able to transform health. John, as you know, there's a study out there called Healthy NC 2030, which ranks North Carolina as 36th out of 50 states in health status. And southeastern North Carolina has the dubious distinction of having several counties that rank in the bottom half of the 100 counties. So we need to improve health in our region. To improve health, and you have to have the data and analytics. You have to have the resources. You have to have really a different mindset to get outside of just the four walls of the hospital and out into the community. We need to address social determinants of health. We need to address the health disparities that absolutely exist in our community and in our region. These are not new things to New Hanover Regional Medical Center. As you know, we've been talking about these for years, but given our size and scope, we've been only able to make a small impact in those in our community. And quite frankly, with the relationship with Novant Health, I believe it is going to bring the resources, the mindset, the capabilities, the passion to be able to truly impact all of those things, which can start improving the health status of our community and make this a healthier, better place to live.
Carl, after the PAG vote, you said Novant and the Wilmington Hospital are natural partners with aligned values and not-for-profit charitable missions. The not-for-profit aside, what told you that the two organizations are natural partners?
Well, John, first of all, I'm obviously, Novant Health is humbled and honored to have been selected to be the partner for New Hanover Regional Medical Center and the community. And I will tell you, it's been because we've worked with New Hanover Regional Medical Center for now 10 years with our Brunswick, Novant Health Brunswick Community Hospital. And that relationship has grown. The interaction with New Hanover has proven that the cultures are aligned, the mission, the vision, the values of our caring for people and caring for the community is very much aligned. And so as we work together on our air link, air ambulance, other clinical capabilities that we've worked on together, we've just grown closer to admire New Hanover Regional Medical Center for what it stands for in just providing superior quality. And really, it was very aligned with Novant Health and our mission of delivering remarkable health care to all in every community.
Carl, what did you know about John Gizdic before this process began, and what have you learned about him since?
Well, John and I have obviously interacted at a number of different healthcare meetings across North Carolina, and we've been on the same side of a lot of issues of caring for all North Carolinians. And John's just a devoted individual, a committed, wonderful leader that cares about people. He cares about not only the people that work for him in that organization, but more importantly, he cares about every member of the community. And you heard him talk about, addressing health disparities and getting at health equity in a community. And I've known John, he stood for those issues for a long time. And what I learned about him more in the issue and just learning more about New Hanover in the process is he's as committed as I am of ensuring that every community member delivers and receives the remarkable care or the exceptional care that they need and deserve.
Okay, John, I'm going to turn it back around again. I got to widen my screen here a little bit because I see your head's popped up a little bit. But what did you know about Carl Armato before this process began, and what have you learned about him in this process?
So as Carl said, our paths have crossed many times over the past probably close to 10 years now, Carl, that we've known each other. And what I initially knew and learned about Carl, from 10 years ago through now is he's very approachable, very collaborative when it comes to, how can we make things better in our industry? How can we make things better for caring for people in our community? I also found Carl to be very progressive. And so, when I would talk about things like health equity, Carl was already thinking about that. He was already there. He was doing things in the communities they serve related to it. And so, those were the initial impressions. As we spent more time together, what I appreciated even more about Carl was something I do think we share in common, which is really being people-centric in our organizations and having that commitment to the teammates in our organization. And that is a common culture that we share. It's also being very physician-friendly. You would assume that's the case in healthcare. It is not always the case in healthcare with healthcare administrators. And Carl is a very physician-friendly CEO and organization. And that's important to me because we have a great medical staff here. We have great physicians in our community, and working collaboratively with them is extremely important. And to see Carl do that in his organization spoke volumes to me. The thing that I have learned since then, since the past few weeks of getting to know each other a little better, to me, is how important family is to Carl. John, you and I have known each other for a long time. You and I have talked about how important family is to each of us. And just being able to talk with Carl and understand, his family and son just got married a couple weekends ago. And to see the importance of family that tells me a lot about a person, and was excited to learn that about him.
As we go through some of the details of the partnership, John, this is called a strategic partnership, but is this really a sale, or is there a difference between a sale and a partnership? To the public, is this a sale?
Yeah, I think that's a great question, John, because I think while some people might call it semantics, technically this will be an acquisition by Novant of New Hanover Regional Medical Center. So on the legal documents, we would be selling the organization. But to me, that is really just the technical transaction. To me, it's about how does this feel? What is this going to be like after that legal transaction? And that's why I continue to refer to it as a partnership. Because to me, that is, as I've talked with Carl, as we've explored this process, we feel like an equal part of something, not like we're having something done to us. And to me, it really reflects the relationship we're going to have in the future with Novant Health, with UNC Health, with the UNC School of Medicine. And so while, yes, technically, this will be, from a transactional perspective, a sale, I think in all practical purposes, it is a partnership and will feel like that for years to come.
And John, just to add on to that, I will share with you that, Novant Health's model is pretty unique in that, even though it's technically an acquisition, at the end of the day, we depend a lot on the local control of the local management team and the local board. And you will see that even in the LOI, and I'm sure it's going to be very clear in the definitive agreement, that local control is very important to our model. It's important because we believe healthcare is delivered locally. We believe that healthcare decisions need to be decided locally, and we will be very dependent on the local management team, the local physicians, and the local board to continue to be the fiduciary responsibilities of healthcare in New Hanover County.
Well, Carl, you jumped me down a couple of paragraphs, but since you brought that up, I'm gonna ask you, one of the criticisms as you listen to members of the community about this process is about that local control. People are concerned that they're going to lose local control. Will the decisions about New Hanover Regional Medical Center and Wilmington Healthcare be made here? Who will be making those decisions? What's the leadership structure going to look like?
Yeah, so John, when I think about all the Novant Health markets, so whether it's Charlotte or Winston or Virginia, those decisions are made locally. So for example, we're going to work with John. If you think about the resources and the infrastructure that Novant Health has built, and he talked about the predictive analytics and the strategic planning and all of those capabilities, we're going to provide data and information and insights of what we see and opportunities. But John and the local board and local physicians are going to decide what happens in the local market. And I'm saying what happens means for me when I define that, that's how we're going to spend capital. It's how we're going to deploy the resources that we're bringing in this relationship and in this partnership. All of that will be decided locally. Where should we build and open up access to healthcare? What should we do to expand the clinical quality and capability? Our relationship with UNC, and how does that grow and expand so that we can do more locally right there in Wilmington? And my goal, John, is to make sure that people can stay home for care. And so I'm going to leave it totally into really those capital decisions, those investment decisions in the hands of the local management team, the local physicians, and the local board.
John, was that important to you in this process to make sure that is mandated?
It was. It was important to the entire partnership advisory group. It was, as you said, John, very important to the community. And so, that was one of the things, again, that was very impressive about Novant's initial proposal and throughout these entire discussions is their commitment to ensuring local control and making sure that the most important decisions about healthcare in this community are made in this community by community members. And so, that was definitely something that was very important to us. And we were very excited to see the lengths that Novant Health was willing to go to ensure that local control.
We've already talked about that part of the whole structure and the whole partnership, John, but of all of the parts of the deal, the $2 billion cash to the county, the funding of the $3.1 billion in capital expenditures, no changes in employment without the consent of the board, the commitment to maintaining provider relationship, even expanding charity care by 200 or 300%. If you go down the lines, there's a lot to this, and I'm sure there's a lot that people aren't going to see. Is there a most important part of this deal to you, or is it all one big umbrella?
So that's a great question, and I'm going to give you two answers. I do think the totality of the relationship is extremely important and brings everything together. But I have said this from the beginning, and I will continue to say it. The one most important thing to me throughout this entire process and throughout this entire relationship is our people. Our teammates are what made this organization as great as it is. Our teammates are the ones who deliver care every single day. And they are the ones who have made this organization the success that it is. And so making sure that our people are taken care of throughout this process, and no matter what happens, is absolutely the most important thing to me. And with that said, I believe that the rest of the commitments that Novant Health has made and bringing all of that to bear will truly be transformative for our organization and for our community, but it starts with our people.
Carl, what about you? Is there a most important part of the deal to you?
You know, John, when I think about the deal, I also think about the people, because it's it's a culture that really allows a strategy to become successful. And I'm so excited about our ability to really integrate the two cultures of caring, the cultures of really focusing on unmet healthcare needs in the communities. And I see the value of those two cultures coming together, the people and investing in the people, being the biggest opportunity that's going to allow the strategies to take off, and that'll eventually allow the overall opportunity to expand access to healthcare. And eventually, when you look at all of that, that's what is going to get me excited about the impact that we're going to have on the community.
Carl, I asked John about one of the criticisms and one of the things that people in the community have talked about. I want to ask you about people talk about the consolidations in healthcare, that they have a tendency to drive up the cost because of the lack of competition. Will that happen here?
John, it will not happen here. And I tell you what, I've prided myself on. I've been with Novant for 22 years, 9 now as the CEO. And I really have paid a lot of attention to driving value. And when I say value, we're known for the highest quality and the most affordable pricing across North Carolina and beyond. So what I'm proud to tell you, John, is we're going to continue to demonstrate how we lead in quality and safety and drive the utmost superior quality healthcare in the Southeast region with John and with New Hanover Regional Medical Center, but we're also going to be very affordable. And so what I would tell you is this is not about pricing. This is more about how do you come together, drive quality, open up access, and really then drive more value to people and be able then to contract for that value that you're providing.
Carl, you don't know this, but John knows this about me because we have known each other for a while. My father was a small town doctor. He was the guy who set your broken leg, delivered your baby, took out your appendix, would make house calls with his little black bag. I remember going on house calls with him when I was a child, to actually go when people would call at night to go see people. But healthcare has changed. We all know that. In your time, since you left Patterson, Louisiana, and since you went to the University of Southwestern Louisiana, Lafayette, and got your undergrad and then your master's degree, and you've been with Novant now for 22 years, has the transition in healthcare really been inevitable to you because of the influence that insurance has on healthcare? It's a completely different animal now from when my dad practiced in the 60s and the 70s and the 80s into the 90s.
Well, John, I will tell you what I've learned over those years is that scale does matter. It matters in a lot of different areas, but the ability to address unmet healthcare needs, to get at healthcare disparities and address health equities and being able to be affordable for all, scale really plays into that. And so I will tell you though, when I think about your dad and the work that he did, it's physicians who really paved the way for what healthcare needed to be locally and in communities and in neighborhoods. And so that's why I want you to hear me say, I started something called the Administrative Physician Partnership to make sure the voices of physicians are integrated in every strategic decision, in every quality decision that we do inside of Novant Health. And I'm looking forward to working with John in building more of that physician, the voices of physicians, and integrating it so that we don't lose sight of what your dad did for those many years of going house to house and caring for people. And so just know that my goal is to ensure that we get physicians' voices as high as we can inside the organization.
I remember when people used to pay my dad with wine and bread at Christmas time. And John, I've told you these stories in the past too, is that it's a different animal. Even in the time, I mean, you're a Western PA guy. You've spent now almost 30 years in healthcare, and you've seen this industry change dramatically. Could you have seen at the time you got into it? I mean, you majored in hospital administration, so you wanted to do this for a long time. Could you have seen healthcare from that time go to what it is now, to really being an insurance-driven industry?
You know, probably didn't see at that time, the insurance-driven piece of it, but I think it's bigger than that, John. I mean, I think it really comes, you know, your dad was caring for one person at a time. What was best for them, what they needed right then. And, you know, as healthcare has changed over the years, you know, I think the model that we have is unsustainable. It's not affordable. It's 18+% of the gross domestic product. And so we need to transform that model. We need to address the health of each individual and how do we help them achieve their highest attainable health status in an affordable way. And affordability means something different to everybody. And so, you know, as you know, we've been talking about that for years at New Hanover Regional Medical Center. And how do we do that? How do we move in that direction? That's easier said than done. But we know we can take steps in improving quality, in reducing cost, in addressing those health disparities, and improving the health status of individuals in our community. But that takes resources. That takes resources from the standpoint of data and analytics. That takes resources as in money. That takes resources as in having the capability and capacity to make those impacts. It's, you know, giving physicians the ability to care for those patients and not have to really be seeing so many patients at one time to sustain their practice. And so there are a lot of changes that need to take place in our industry. I think we can do that collaboratively with insurance companies if we can find the right approach. And again, I will go back to that is something that we have seen. We have been talking about at New Hanover Regional Medical Center for years. That's really what our mission and our vision call us to do. It's a very ambitious mission and vision. The question is, how do we do it? How do we get there? And that's what led to the partnership exploration. If that's truly what we're committed to, we need to find a way to make that happen and make that a reality. And so when I talked about choosing possibility, you know, sometimes you have to do things differently and really get out of your comfort zone to create that possibility. And I truly believe that's what we're doing.
John, you mentioned mission, but one of the first things you did after taking over as CEO when Jack left was change the organization's mission statement. Why did you do that?
It's a fair question. It's a great question because the mission of an organization is why they exist. And it is what that organization's North Star should be. And there was nothing wrong with our old mission, but it was a very traditional, historical sick care centered, kind of hospital centric mission. And just like the conversation we just had, looking forward, it really needs to be about the health of the community. It needs to be about embracing all aspects of the individual, not just health care. And so really trying to move our organization in that direction and understanding that our patients are our patients even when they're at home, not just when they're inside the four walls of one of our facilities, and really trying to change that mindset for our organization and lead us in that direction so that we could make an even greater impact in the health of our community.
Did you have a lot of trouble with buy-in?
You know, absolutely not. Our staff was phenomenal. They were so excited about that mission. I mean, they really, our staff, our providers, really latched onto that and have been running with that. And you can see over the past almost now 4 years that I've been the CEO, the great changes that our staff have made in engaging in the community differently and really volunteering in our schools and building homes for Habitat for Humanity in so many different ways that they are looking at the health of our community differently. And I could not be more proud of them and how they have just embraced that mission and really looked at different ways they could improve the health of the community.
Carl, one of the things that you did after becoming CEO was you started a blog. And at one point, you even put, I guess, 146 of those blog entries into a book. Was that something to get out of your comfort zone? And what did you learn from that?
Yeah, John, well, the thing that hit me when you were just asking John about the mission of the organization is, you know, when I took over, we had 400 brands. And so we became Novant Health under my leadership. And what I wanted people to understand is that what does it mean to wear the badge at Novant Health? You know, in the mission of improving the health of communities, one person at a time. We talked about the one person at a time and how important that is. And the vision of, you know, we, the Novant Health team, will deliver the most remarkable patient experience in every dimension, every time. It's that every dimension, every time, whether you're in the front office or the back office. And then we actually changed the values also. I mean, we added diversity and inclusion back in 2012. We also added the word courage to values that already existed, like compassion, personal excellence, and teamwork. And so I say that all because it was the blog that allowed me to connect to 30,000 people every Monday. And I still write that blog, John, and it's a blog about any topic that we might have on our minds, or I'm hearing from the team that we might need some conversation about. It could be about diversity and inclusion. It could be about the remarkable patient experience. It could be about remarkable quality and safety, but it's about letting them have a voice directly to me. And some of the blogs, John, I even do open blogs where there's no topic and 30,000 people can ask me questions on a Monday for 2 hours. And so, you know, I have found it's the best way for me to stay connected to what's really going on the front lines of patient care and in our support areas. And so, John, it's been very beneficial. I'm glad I did it. It did take a little courage because I was probably one of the first that stepped out there and started to do it. And even my own internal communication team was saying, you don't know what you're going to get. We don't know what you're going to get. But you know what? I got a lot of committed people sharing ideas that have just been remarkable for Novant Health.
Carl, and this question, I want to ask it in a way that's respectful, but I don't want to intrude. But from what I understand and the research I did, you were a little hesitant to come out and tell everybody that you're diabetic. And it seemed like you were hesitant to share that. How come? Because it would seem like it would make someone, forgive the phrase, more human in the front office.
Yeah, so John, I'll share with you, I'm much more comfortable today than I was earlier in life. So I was diagnosed as a type 1 diabetic when I was 18 months old, 18 months. And so there were back in those days, there were no glucometers. I was carrying around a little test kit, a chemistry set kit. And I'll tell you, what happened to me in my early years was I heard a lot of stories of I might not make it, past 20 or 30, or they told me I was getting an eye checkup one time. I was sitting in the chair of the ophthalmologist, and he was looking at my retinas, and he said, Carl, you don't have any damage now. And he was asking me what I wanted to do in life. And I was only 14, 15 at the time, and I was talking about becoming an accountant, a CPA. And he looked at me, John, and he said, "Ooh, you might want to try another career, that you might not be able to see after 20, 30 years with diabetes." And I was frightened, John. So I started to hide it. I was worried that by telling people they would hold me back or not allow me to soar or do things that I thought I could do. And that was wrong to do that. But back in those days, people didn't have a lot of confidence that you could do a lot and survive. And people were more cautionary about letting you do things. And so I remember going home after that doctor's visit, though, and my dad pulled me aside. He had me get on our knees, and we said a prayer, and I never forget the prayer because it's why I'm here today. Part of it was, John, just to allow me to deal with diabetes the way I can and manage it the best I can. And then the second part was allowing me to use diabetes to help others. And so what I'm telling you today is I'm out talking about it, helping other type 1 diabetics, and I'm using the disease as I go into every board meeting, every discussion about care, is I look at it through the eyes of a patient, and what is it that I would want so that I can give it to others.
Well, John, to humanize you a little bit, what do you think might have happened had that test you took in high school showed something different, that you may not have gone into hospital administration? You may have gone a different way?
Yeah, so, it's interesting. That test actually did say something different. It said three things. It said that my three top interests or possible careers would be biomedical engineering, pharmacist, and healthcare administration or hospital administration. So, John, biomedical engineering and pharmacy require you to be really smart. So I looked at that number 3 there, and no. So, it's interesting because looking at those three things, I actually thought I wanted to be a pharmacist. And that was going to be my first choice. And I had the opportunity to shadow a hospital administrator when I was in high school. And it was just amazing to see everything that went on and all the different ways that they were able to help people, interact with the community and everything. So, yeah, it's amazing to think about what if, but I think Carl's story is an important one, because as leaders in our organization, and it doesn't just, you don't have to just be the CEO. We really have, I think, the opportunity, but also the responsibility to role model for our organizations. And, I've talked about this over the years, and I think it's very important to humanize everyone as a leader, and we're all just people at the end of the day. And, put the titles aside, put all that aside. The reason we're all here is to care for our community. And I think every opportunity we get to show that to our staff and to our organization, you've heard me say this, I think the most undervalued trait in leadership is vulnerability. And we have to role model that and make it a safe place in our organizations for people to be human, to be vulnerable. Because let's be honest, we're all dealing with stuff, right? I mean, we're dealing with stuff at work, we're dealing with stuff at home. And to pretend that doesn't impact us everywhere in our life, we're just kidding ourselves. And so how do we set that example and be able to tell our story, because it's not about us. It's about, by telling our story, we're empowering somebody else to be comfortable telling their story.
And don't want to get too much off topic here, but everybody is dealing with something right now. And how is New Hanover and the entire network dealing with the pandemic? I mean, we see the statistics, they come into our newsroom all the time, and we're giving people numbers on a nightly basis of people that are hospitalized across the state and people who have lost their lives. But you're walking around inside that hospital. How has New Hanover and how is New Hanover Regional dealing with this unforeseen, once in a century happening?
You know, I'll give you several different answers. You know, first and foremost, my staff and our providers are doing a remarkable job with dealing with this. As a matter of fact, right before we got on this podcast, John, I went up and rounded on our COVID unit. And I just can't say enough about the staff up there, the providers up there, the compassion they have. This is just an unbelievable example of people putting the community's needs above their own personal needs. Every day, they're entering a very challenging situation and doing so with remarkable compassion and professionalism. And I could not be more proud of what they're doing in a very difficult situation. And so, you know, because COVID is very real. We see the numbers, but behind those numbers are people. And that's what's most important. Is it's a lot more than numbers. These are people, these are friends, these are family, these are neighbors right here in our own community that are very sick. And as you said, we even see the numbers of those who have died because of this disease. And so we need to take it very seriously. And we are at New Hanover Regional Medical Center. We're being very diligent about personal protective equipment, about being very diligent about hand washing and precautions that we can take. But at the same time, it is a struggle, because COVID shows us as a community, and quite frankly, as an organization, just how vulnerable we are and just how fragile we are and how quickly circumstances can change. And so it also, to me, shows the value of having those additional resources and having a larger network of partners to be able to tap into and rely on it. If you think about, as you said, a once in a century situation, we're having to deal with this on our own. We're having to find PPE on our own. Financially, we've taken a big hit from COVID because of doing the right thing and trying to limit procedures, which happen to be our profitable services. Recovering from that financial hit, we're going to have to do on our own. So there are a lot of impacts from COVID-19. I think first and foremost is the impact on the people in our community. You mentioned earlier, we were talking before we got on the air about the impact on schools. Well, we think about the impact on schools, that impacts our staff. I have 7,500 teammates. Many of them have school-age children. Most of them cannot work from home. They're caring for people. And so this directly impacts their abilities to work and to care for their children. And so they're facing, on top of this pandemic, they're facing, how do I address my home situation for my school-age child? And how do I deal with that within my family? And so there's so many impacts of COVID that I think as a community, we really need to keep that in mind and look at, beyond those numbers, how it's impacting people.
Carl, what about you? What have you seen in your network and in the places that you have gone as far as just the impact of this pandemic?
Yeah. John, I'll start with, I'm very proud of our physicians, our advanced practice providers, our nurses, and our support staff. And I'm going to give a plug for all the analytics that went into building our capabilities. We actually at Novant Health were able to get ahead of it. And what I mean by that is our team, our scientists and our data analytics folks built predictive modeling that by market, by facility, by location, it cuts across diversity and inclusion and health equity. It shows the impact of where we're seeing volumes, where we're seeing more COVID activity. We were able to early get out in the community and open roughly 25 testing sites, which these respiratory assessment centers allowed us to quickly find where COVID was, spreading quickly and rapidly. And so, for example, there was I'll give you this example. We were dealing with a Hispanic community where the positive test rate was as high as 30%. Wow. And so by getting in there, and then we've already distributed 450,000 masks to those in need. We were able to get in there with education, testing, social distancing discussions, and masks, and we brought that positivity rate down below 10%. So what I'm getting at here is the analytics behind it has been very helpful for us to keep up with the personal protective equipment, to keep data in the hands of our physicians so they knew where and when patients and what kind of patients were experiencing mortality issues and other factors. And now I'm proud to tell you, John, that we've got a 91% recovery rate in all of our hospitals. We've already sent over 2,200 patients home that were hospitalized. So what I'm excited about is our team got ahead of it, and our doctors and our frontline nurses and advanced practitioner providers are doing remarkable work.
Carl, this process, the letter of intent says has to be done by October 31st. But what are some of the first things the public might see from this partnership? Name changes on buildings or logos. What in your mind are some of the first things the public will actually see?
Yeah, John, I would tell you that the first thing I believe the public's going to see is John and I and the local board will be working together with the local physicians to really look at opportunities to address health equity and address maybe some of the social determinants of health and try to eliminate health disparities. You may see us also look at what other opportunities can we do to open up access to healthcare. So I would be less focused on name changes and things that in my mind can be discussed and come later. We're going to be focused on what can we do to drive value to the community that we're here to serve and the communities, the surrounding communities. And I go back to, I'd love for people to be able to stay home for healthcare and not have to travel. So our relationship with UNC and expanding the pediatric subspecialty capabilities and allowing us to grow other clinical services so that people don't have to travel. Those are the kind of things I think you'll see us focus on early and right out of the gate.
John, will a patient or will a family have to worry about a change in insurance coverage or something like that once this deal takes effect?
Absolutely not. So I think that's, again, a great part of this relationship is the commitment to make sure those relationships remain intact and that there is little to no disruption to patients and their coverage as a result of that. And as a matter of fact, quite honestly, I think we're going to see an improvement there. Novant has a much more generous charity care policy currently than New Hanover Regional Medical Center does. And so we're talking about the ability to implement that right away to be able to offer more care, more affordable care to more people. And the fact that community members in the areas that Novant serves don't even get a bill if they're within 300% of the federal poverty limit is remarkable. And so I'm excited about the opportunity to not only maintain the existing access that we have, but to be able to offer an enhanced charity care policy related to that. So I think there's tremendous opportunities there as well.
John, at some point in time, I'm going to have to give up my seat on the anchor desk here at WECT. I don't know, they may kick me out before I'm not able to do it again. But 5-10 years down the line, maybe when I'm not doing this anymore, and you've talked long term, 5-10 years down the line, what are we going to notice that we'll look back and say, that was the right decision? What kind of a sign will we see? And I'm not talking about like a logo sign. I'm talking about a sign in this community that I'm going to say, or somebody in this community is going to say, that was a good decision they made back in 2020 to partner with Novant Health.
John, I think that is a great question. And I think that's what we should be talking about and thinking about as it relates to this relationship. And I could talk a lot about individual things. To me, it's going to be, has the health status of our community improved? And really seeing, to me, the health rankings of our region improve. There is no reason, to me, my vision, it should be unacceptable for us to rank in the bottom half of a state that ranks in the bottom 25% of the country in health status. We should want better for our community. I know we were talking about your grandchild. We should want better for ourselves, for our children, and for our grandchildren, and for them to be able to lead healthier lives right here in our region, not have to leave here. And, so I think about, and when I think about possibility, Loma Linda, California has the distinction in the United States of having the most centenarians, those who live above 100 years old, anywhere in the United States.
I'm not that old, John, but yeah, I'm getting there.
But you want to live to 100, right?
I'd like to. I don't know if Sheila wants me to, but I'd like to.
She wants to live to 110.
Yeah.
Why shouldn't that be Wilmington, North Carolina? Why shouldn't that be southeastern North Carolina? Why shouldn't we have the distinction of being one of, if not the healthiest communities in America? This relationship, the resources that we're talking about through this relationship, both for our organization and for our community, absolutely can make that possible. And so I believe, maybe not in 5 years we can accomplish that, but we should see signs of the health status in our community improving, disparities being reduced and eliminated, and that we are on the path to being destination health in the United States.
Carl, I'm going to put the same question to you. What is a sign that people would see in 5 or 10 years that they're going to say Novant was the right partner for New Hanover Regional Medical Center?
Well, first of all, John, I will highlight first, you will see us addressing unmet healthcare needs, whether it's the health disparities that we talked about, behavioral health, whether it's, I was thinking about whether it's alcohol addiction or opioid addiction. You're going to see us bringing resources into the community that opens up access to healthcare. So in my mind, that's a 5-year, people will see it, feel it, and be part of that. When I look out 10 years, though, I go back to what John ended with, and that's, I really want New Hanover Regional Medical Center to continue to build on its high quality legacy with remarkable physicians. And I want it to be the destination place, not only for patients, but for physicians that are studying medicine and others in the community. It ought to be the destination place for research, the destination place for healthcare in the southeast part of North Carolina. So I'm actually looking forward to building that day and continue to build it day by day so that this is the destination place for healthcare.
Is that realistic? Can Wilmington become that destination for research and med center teaming up with the UNC Med School?
I think it's highly possible, and there's a great opportunity. When you look at what we're going to come with initially with UNC, with just expanding the number of residents from 18 to 30, expanding the clinical research, expanding other capabilities on research and clinical capabilities. When I was thinking about the pediatric care that we're going to expand and the subspecialty care for pediatrics, there's more and more opportunity there. And I think it'll be up to John and the local board and the local physicians to expand those capabilities with Novant Health.
Yeah, John, I'd jump in there. I absolutely think it's possible. I mean, we know we have a great place to live, right? We have the natural assets here already. They didn't tell people like you and me that there were schools at the beach. You know, we ended up in the middle of Pennsylvania in the snow in school. And so who wouldn't want to come to southeastern North Carolina to live, work, and play? And when you think about the natural assets we have, you think about the fact that we would now have the expanded relationship with UNC School of Medicine. We're talking about medical school training here. We're talking about potentially, you know, an allied health campus here in Wilmington with schools of pharmacy and dentistry and allied health. You take training students and clinicians here who typically stay here. You combine that with the investment that Novant Health is going to make in our organization. We talk a lot about the proceeds from a sale. The capital investment is even more than that. And so we're going to have the facilities, the services here, and spread those throughout the region. And then you combine that with the $1.25+ billion that the community will have in a community benefit foundation, unlike almost any community seen in the country, to invest that in improving our community. That to me is a recipe for success and absolutely makes it possible for this to be that destination for people wanting to come here to not only live because of the phenomenal health and community we have, but come here and be trained and stay here after they're trained.
Both of you, your time is very valuable, and I appreciate it. I want to ask one more question to both of you, and John, I'm going to ask you first. Who was one person, personally or professionally, who's meant the most to you getting to where you're sitting right here, right now?
And you and I have talked about this, John. And it's hard not to get emotional, but it's my father. My dad had a high school education, worked in a steel mill, but was a great read of people. And unfortunately, because of our economic situation growing up, did not have access to health care. And he died at age 46, unexpectedly. And in the short time I had with my father, he taught me the value of relationships, and he taught me the value of a strong work ethic, and he taught me the value of doing the right thing no matter what. And so when I think about the tremendous blessings and opportunity I have to be the CEO of New Hanover Regional Medical Center, in large part, I believe it's because of the lessons my father taught me, and I believe he has been watching over me for the past 23 years.
Carl, who's the one person, personally or professionally, that's meant the most to you getting to where you're sitting right here, right now?
Well, John, I started my discussion with you today about me being a type 1 diabetic and dealing with that at a very young age and growing up very quickly. And, you know, my parents were remarkable in that process to be there for me. But my dad was he kind of opened the door for me to see how I could maybe use diabetes to help others and help those, and particularly in healthcare, which is what led me from being a not-for-profit tax guy who worked on executive comp plans with physicians and executives to really walking the halls of hospitals and wanting to be part of that. So I have to tell you, my father, he's no longer with us today, but he would be very proud. He told me one day that I would use diabetes to help others, and he was right. And so I continue to go into every meeting with him and that in mind.
Carl Armato, President and CEO of Novant Health. I appreciate you taking the time to join us today.
Yeah, John, I look forward to not only being in the community, but working with John locally and the board locally and the physicians there. I can't wait to get the definitive agreement signed so we can really start to show and add value to the community.
And John Gizdic, President and CEO of New Hanover Regional Medical Center. I appreciate you taking the time today too. It was interesting to to get to know both of you a little bit more and peel a little bit of the curtain back, but also get your thoughts on what this is going to mean to southeastern North Carolina.
John, thanks. I appreciate the opportunity. It's always great to talk with you, and I am very excited about what is possible through this relationship.
Now, negotiations on this process still have a long way to go, and WECT News will cover those negotiations and the process all the way through, keeping the public informed on the sale of the Publix hospital. You can find that coverage on a daily basis on WECT.com and the WECT News mobile app. If you'd like to learn more about the two organizations in the forefront of this potential sale, you can go to NHRMC.org to learn more about New Hanover Regional and NovantHealth.org to learn more about Novant. Now, before we go, I'd like to ask you a favor. Please download and subscribe to the One-on-One with John Evans podcast on whatever app you use to listen to your favorite shows. And if you would be so kind, please leave us a rating or a review. The more feedback we get from you, the higher we'll be listed on the podcast apps, and the better chance we'll have of bringing in even more new listeners. I'm John Evans. Thanks so much for joining us for this week's episode of One-on-One.